we should be starting soon. They're giving me fluids, and then they're gonna pre-treat me because I have an allergy to contrast. So they're gonna start that now. So when we do the surgery, they don't have to worry about me having an allergy. But I will be back when I have another update. Matt stepped out of the room to get the kids to school. My sister-in-laws are helping with pick up and drop off today. But yeah, so I'll be back. Hey guys, so I'm back home. I got discharged around 7:30. I'm not gonna lie, it was horrible. It was so bad. I only think it was that bad because I'm in a sickle cell crisis. So I would advise, if you're gonna get a PFO closure, to try to not do it in a sickle cell crisis, or if you wake up in a sickle cell crisis, just see if they can postpone it, because this pain ain't worth it, y'all. It was supposed to have been light sedation, but I ended up getting put to sleep because it was just way too painful. Let me start at the beginning. So they take you back to the room and get you like all hooked up and settled. They put these little things on you. My hospital, there were stickers. They put one on the front of your chest or the back of your chest, and then like on the side, just in case they have to shock your heart. And because they are messing with your heart. And sorry, I ate a granola bar. I haven't eaten all day. But they cover you in leads. Like, literally, I had so many leads on. The nurse took some off, Matt took some off, I took some off, and there still was some on me. Like, there were so many leads. They start with 3 injections where they are gonna go. They went in my groin, and I still felt like everything when he was like pushing the thing in to expand the arteries so they can get the little thing to go in. I'm not sure what the term is. They have this big machine over you that's looking at your heart as they go, so they make sure that they're doing what they're supposed to be doing. But he had to switch that because my hole was a lot bigger than we thought, because I felt them, what I thought felt like came out, and he exchanged it, like switched it out. So I'm like crying in the meantime. They gave me the sedation along with fentanyl, because like I said, I was in a crisis, and that didn't work. I was still crying and like felt like I was going into an anxiety attack, just because like the pain from that, the pain from like my legs and stuff hurting, it was just a lot. So they ended up doing the second dose of the medicine, and it still didn't work. Like, my pain was through the roof at this point, and I was just like crying so bad. And then they did a third dose, and I just remember being completely out of it, like went to sleep after it, and I woke up in my room. The staff was amazing, the doctor was amazing, like all of them. They were just trying to talk me through it, telling me that, I'm doing a great job, we'll be done in no time, and things like that. But like, when you're in pain, that mess go in one ear and out the other. Like, you don't care about none of that. So I woke up like in my room, and then I will only wake up crying. Like, my hips and my legs hurt so bad. One thing I forgot to mention, like the thing, like I did tell him that my chest is starting to feel funny. Like, I'm starting to get like chest pain or whatever, because putting the thing in there, And I'm not exactly sure how they did, because like at first I was like looking at the screen to kind of see what he was doing, but when that pain picked up worse, I wasn't looking at nothing. What it kind of reminds me of what it felt like was like someone's like trying to, you know how when somebody's trying to tickle you and like the digging or whatever, but it wasn't funny. It felt like somebody was like tickling my heart, and I did not like that feeling at all. I have a heating pad on my chest. I had it on my legs and my hips, but my chest is hurting bad. So I'm gonna call them tomorrow and ask them if that's normal. But I woke up in my room and I would only wake up to cry. Man, I say like I stayed asleep the whole time. Like I would just wake up crying, complaining about pain, and then I would just kind of like fall back asleep because of like sedation and stuff. So the nurse came in. The nurse was like so amazing. Like he was so sweet, so considerate. Like making sure that I was okay, if I needed anything, making suggestions, just like, if this stuff doesn't work for you, you won't hurt my feelings if you tell me to like be quiet or leave you alone or anything like that. And I'm like, no, it's fine. Um, every so often he came in and he put pressure on it. I had to end up getting stitches, but every so often he came in, the nurse, and like applied pressure to just make sure that, it wasn't bleeding, because they did go through an artery. And then they gave me something for pain, and he advocated so well for me to the doctor. Like it was amazing, and the doctor was amazing as well. Like he didn't have to jump through any hoops for the doctor to be able to treat my pain or anything like that. We did do hydration the day before the surgery and then the day of the surgery, and it just wasn't enough to stop my crisis. So right now, I'm just in so much pain. Like my hips down hurt, and then like they took the stitches out, and that hurt so bad. So I'm just in a lot of pain. Like I'm not even gonna cap. I'm in so much pain. If I still feel like this tomorrow, then I'm gonna go back, because I don't want to try to tough this out with this thing being inside my heart and make matters worse. Um, I do have to take a baby aspirin on top of my blood thinner for 6 months. And if I have any type of dental work done, I have to be on antibiotics for 6 months, just to make sure that I don't develop an infection and it goes toward my heart or anything like that. What was in the discharge papers that was like, that the nurse specified was like, if I start bleeding, I kicked it over. I'm sorry. Was like, if I start bleeding from the site, rather like the blood is on the outside of the inside, I need to call the ambulance and let them know that I'm bleeding from an artery and I need somebody to get here like as soon as possible. Because he was like, if it's bleeding on the outside, obviously you'll see the blood pouring out. But if it's bleeding on the inside, it'll be tenderness, it'll be swollen, it'll be extremely painful and everything like that. And I need to call the ambulance. Like, don't try to drive to the emergency room, call 911 and have them come pick me up. And then he was like, if I develop an infection, that's extremely important as well. But I can call the office and let them know, hey, I think that I have an infection, which is like oozing, foul odor, again, swelling, and intense pain. But other than that, I'm just kind of taking it easy. I can't drive right now, and I'm not allowed to lift over 5 pounds. So for about a week. So that just kind of like leaving, not really doing anything. It hurts so bad to walk and put any type of pressure on my legs and my hips. And that's the update right now. I will call and keep you guys updated. So today is day 2 of my PFO closure, and I have to go back to the emergency room because I'm having chest pains and I have this pain on the side of my stomach, and my hips and my legs are still hurting really bad. The hips and the legs, it's like sickle cell, but they want me to come back in to get an EKG, CAT scan or something to make sure that I don't have fluid build up around my heart and inflammation, because I shouldn't be having chest pain. The chest pain is continuous and it hurt really bad when I take a deep breath. So I'm getting ready to head to the emergency room.
Well, it's pure pandemonium enough.
Hey guys, so I'm still in the hospital. My troponin levels, which is your heart enzyme, ended up going up to about 30. Like it was like 28, and it's supposed to be a single digit. So the PFO caused some type of stress on my heart, which is why I was having the chest pain and chest pressure. And my red blood count dropped to 7, and then my white blood count went up to, I think it was like 14 or 15. My levels have slowly started to go back to normal. My troponin levels are an 8 now, so they dropped. I think when my pain was the most severe, my enzymes were probably over 30, because by the time I got to the hospital, like I said, it was at a 28. I'm not having any more chest pain at all. Like I'll have I wouldn't say at all. It comes and goes. And then I'm having, my hips aren't hurting anymore. My legs just hurt. I should be able to go home sometime today, which I'm praying I can go home sometime today. But I just wanted to give you guys a heads up. I don't think my case is normal with PFO closure. I think it's just my sickle cell played a big part in it. And just anytime I do surgery or anything like that, my body just is kind of like, what are you doing, essentially? And just causes some type of stress. So even like the simplest of things can throw me into a crisis or whatever. I was regretting getting the closure when I was in the thick of the pain, but I think it's just because I was in the thick of the pain, honestly. And to just have so much pain that like I couldn't put any type of pressure on my legs and my hips was just absolutely insane. But now that I'm like over the hurdle of most of the pain and I can get up and use the bathroom again and everything like that, like I know why I did it. I have a history of clots, and I've been getting like a lot more clots, and all it takes is like one of the clots to go to the opposite side of my heart, and it's essentially deadly. So I don't regret doing it. I just regret like how bad things get after any type of surgery or whatever. But it's a port catheter moving along my spine, and it feels weird. But yeah, I just wanted to give you guys an update. Matt and the kids came by every night I've been here pretty much to come eat dinner with me, which I greatly appreciate, because I know that's hard, like having to travel to the hospital with the kids and food and all of that type of stuff. So I really, really do appreciate that man and my babies. Like, we legit stay on FaceTime the whole time I'm pretty much in here, because I'm always with them. So it's just different to not be with them. But I wanted to give you guys a quick update.